Welcome back, Infinite Art Smart, where art makes you smart and happy, and dare I say holy, as we explore the sacred beauty and joy of art in our life. And that was, hear me talking to ya. We're going to talk about that. We're going to talk about the human ear. And are you listening? Can you actually hear what is coming at you? And can you put your filter on? We're listening with everything. We're listening with our eyes. We're listening with our ears, of course. We're listening with our senses of smell and taste. And, you know, what does it tell us? Do we like it? Is it really not that good? Maybe we need to up our health of our ear. And I'm going to dive into that with our artist of the month, Jean-Marc Gaspard Itard, French physician, born in Provence. And he's perhaps best known for his work with Victor of Avignon. And we're going to get to that. That was a young boy who was disabled. Dr. Jean-Marc Gaspard Itard. He was without a university education and working at a bank, but was forced to enter the army during the French Revolution. After successfully working as an assistant physician at a military hospital in Soliers in 1796, he was appointed deputy surgeon at Val-de-Grâce Hospital, a military hospital in Paris. And in 1799, a physician at the National Institute of Deaf Mutes. In Paris, he was a student of the distinguished physician René Laennec, inventor of the stethoscope, and his major work on otology, describing the results of his medical research based on over 170 detailed cases. In 1821, he is credited with the invention of the Eustachian catheter that is referred to as Itard's catheter. In 1825, he was the head physician at the Institution Royale des Sourds-Muets and was credited with describing the first case of Tourette's syndrome. Now, Victor, this young boy, was a feral child and was found around the age of 9. Not only is he considered one of the most famous feral children, but his case is also the most documented case of a feral child. Upon his discovery, he was captured multiple times, running away from civilization approximately 8 times. Itard, who worked with the boy for 5 years and gave him his name, Victor. Itard was interested in determining what Victor could learn. He devised procedures to teach the boy words and recorded his progress. Based on his work with Victor, Itard broke new ground in the education of the developmentally delayed. He wrote an account of this experience, an historical account of the first developments, physical and moral, of the young savage caught in the woods near Avignon in the year 1798. So I want to show you a picture of him. Here's a 19th century painting of the man, Jean Itard. What a pleasant demeanor. You know, he really wanted to help this person. And he really worked hard with him. Has a museum of disability. And they give a little history here, which is very nice. So he traveled to Paris in 1796 to study medicine. After becoming an accomplished surgeon, Dr. Itard worked at the National Institute for Deaf Mutes. Dr. Itard was interested in the study of training deaf mutes, and he took an interest in Victor, a boy of the Institute. Victor had been found in the woods around Saint-Sernin in southern France, an apparent wild boy with virtually no exposure to civilized society. Now, how did that happen? The Society of Observers of Man claimed the boy for observations. And Dr. Philippe Pinel, one of the 5 observers, delivered a report claiming Victor was an incurable idiot with no chance for improvement or education. And Dr. Itard disagreed with him and went against the recommendations, keeping Victor at the Institute and personally training him for almost 5 years. Though never making the progress he had hoped, Dr. Itard's techniques and willingness to stand up for the cause of Victor the Wild Boy were very influential to the training and education programs of the time. In 1825, Dr. Itard described the case of Madame de Dampierre, a woman who had a habit of shouting out obscene words during conversation. 60 years later, this case was cited as an example of what would become known as Tourette's syndrome. I'm very familiar with that. I worked with that when I was a mental health technician at Circles of Care here in Brevard County. So fabulous that this man was determined to try to help this boy. And I want to go on from there and talk a little bit about doctors today say is proper ear care, how we can better take care of our ears. And of course, one of those things is diet, but foremost is loud noises. And protecting our ears from very loud noises, especially we musicians need to realize this. And then I was taught by someone in the medical field that not to exercise with loud music. You know, you have to kind of turn it down. That's why our phones have these gauges on them that says, you know, over this decibel it's not safe. It's very true. So while you're exercising, if you like to exercise to music like I do, or you're a musician, we're going to have to put in some earplugs and protect our ears, or some sort of, you know, headset to cover our ears. And then the other danger is alcohol. So they did studies on, you know, construction workers who were drinking and, you know, pretty heavily after work, and then they'd go to that work in the day and all that loud noise, so there was an increase in depression. So we really need to be careful about these things. And so I'm going to read a little bit for you here from the American Medical Association and what doctors wish patients knew about proper ear care. People may overlook their ears and take for granted the ability to hear. It is essential, though, not to wait until an issue arises before giving your ears the attention they deserve. That means caring for them proactively today. Engaging in proper ear care is instrumental in maintaining optimal ear health, as it can reduce the risk of ear infections and prevent hearing loss. But it can be difficult to know where to start when it comes to improving your ear health. That's another thing I want to mention. You know, these cars that have these speakers that are booming this loud bass music. I kind of wanted to say to those people, do you know what you're doing to your ears? Do you want to be deaf? Do you not want to be able to hear any kind of music at all with what you're doing to your ears? Let's start thinking about ear health now and when we're young, and let's teach our children about ear health. In short, this is Dr. Jones says, you can improve your ear health the same way you take care of the rest of your body, which can be done through hygiene, lifestyle choices, appropriate medical consultation. It's also important to be sure that you identify issues and get treated or looked at for what you might think are minor issues before they escalate into bigger problems. One of the most important things, because of prevalence of hearing loss, is making sure you protect your ears from excessive noise. Dr. Jones said we all live in an industrialized society, so make sure that you're not exposed to loud noises or even moderate noises for prolonged periods of time, which can also cause hearing loss. Most people can recall going to a concert when they're younger and they come out of the concert and their hearing is muffled or clouded. I remember that with my first concert I went to hear, and it really scared me. Dr. Hunter said, noting, and when that gets better, that's called a temporary threshold shift. Most people can recall. We want to protect our ears so that we can avoid something like that, because that is an indicator of damage to the cochlea. There's a free phone app where you can ensure that the decibel level that you keep is below 70 decibels, and it's a really great idea. So wearing hearing protection at a concert's a great idea, but even leaf blowing, lawn mowing, and hair dryers, because of the proximity, a lot of times can cause hearing loss. And if you've already experienced hearing loss for whatever reason, then your ears can be more sensitive to loud noises. Obviously, jet engines and those kinds of industrial noises most people are aware of, but the more common everyday activities can also, over a period of time, give you hearing loss. And that is no fun. You can't hear people speaking, you can't hear beautiful music, you can't hear beautiful nature. Now he starts to talk about our vitamins and minerals, and some things are beneficial, such as vitamin A, vitamin C, and vitamin E, along with minerals such as zinc, have been touted for potential benefits in maintaining ear health. But in general, all antioxidants are healthy, particularly for vascular health. Things like drinking green tea and eating blueberries, broccoli, and other things such as bananas and dark chocolate. And these promote anti-inflammatory diet, which is rich in antioxidants and flavonoids. So also, let's talk about cleaning. Ears are actually self-cleaning. For most people, the ear canals do a great job of cleaning themselves. You can consider it like a self-cleaning oven, says Dr. Jones. Skin in your ear canals, like the skin on the rest of your body, sheds. Ears have a coordinated dance, if you will, that allows the skin to come out of the ear canal on its own. That skin in your ear is like a bucket, and if it doesn't have a coordinated fashion of getting out, that bucket will fill up. We know there's a natural skin migration in the ear canal, and that helps remove skin that had shed. It's a combination of dead skin and wax that constitutes what comes out of our ears. So for most patients, the ears clean themselves as long as they get water in there. That should help. And noting some people have more narrow ear canals, or the outer portion of the ear canal might not line up with the inner portion, and that could prevent the wax from coming out naturally. In those situations, we do recommend patients come in and get it cleaned out, but generally, if you leave it be, your ears will be okay. Isn't that fascinating? That they kind of take care of themselves. Put the Q-tip back. Since the 1970s, there's actually been a warning label on Q-tip package not to place them in your ears because of all the issues and injuries that physicians like Dr. Hunter has encountered over the years. You think you're getting a lot of wax out and you may get some up, but your inclination is to actually push the wax down beyond the outer third of the ear canal where the hair is. And if you get beyond that hair, then there's no real mechanism for the ear to get this cerumen out, and you get plugged up with wax. That tends to reinforce the idea that I need to clean my ears up because I've gotten more plugged up a couple times, when in actuality you're causing it rather than treating it. With that, you can clean the outside of the ear, but when you start going down in the canal, that's when you run into potential difficulties. And then he talks a little bit about peroxide. So peroxide can be safe to use, generally pretty safe for the ear, even the middle ear. For example, if you've not had previous ear surgery, you don't have a perforation in your eardrum, and it's to get wax dislodged, it's not completely out of bounds to use a little bit of peroxide. Sometimes, though, people use it for things that wouldn't make sense. For example, if your ears are itching and dry, then peroxide's actually going to make that worse because it tends to dry out the ear as well. Talks a little bit about finding ways to prevent viral infections. Upper respiratory infections can cause inflammation in the nose and cause swelling and lead to a fullness sensation in the ears. And this fluid can cause fluid deposition, which can potentially cause an ear infection. But almost all viruses could potentially affect the ear, whether that's fluid buildup or inflammation in the inner ear, causing a hearing loss or a balance impairment. There's no way of predicting who is and is not susceptible. For example, you get the flu, and that can affect your ears. We always ask about a precipitating illness when patients present with hearing loss. Whether they had a cold exposure recently, because we recognize a viral infection can lead to sudden hearing loss, as well as dizziness. And then they talk a little bit about addressing your allergies. If you're allergic, there's a colloquial expression that as the nose goes, so goes the ears. That's why we have ear, nose, and throat doctors. So if you are congested or you have some allergies, you have a little bit of thickened posterior nasal drainage that goes by the eustachian tube on its way to the lower parts of the throat. It can cause a little bit of inflammation or swelling at the origin of the eustachian tube and give you a feeling of fullness or pressure. It can lead to that. As far as the itching ears, in my experience, that tends to be more related to dry ear canals, or perhaps you may have a tendency toward atopic dermatitis. And you can get those changes in the ear canal just like you can anywhere on your skin, your elbows, your knees, etc. This is usually treated with more topical medications like a liquid topical steroid or something like that to stop the itching. And then it's okay to pop your ears. I know there's a lot of questions about that. I'm going to put this link below so you can really dive in. But important is to recognize your signs of hearing loss. You notice you're turning the TV up and everyone else around you is wondering why, or you're having to ask people repeatedly to go over what they just said. It can be an indication you've got some hearing loss. Ringing in your ears could also be an indication. For a lot of people, hearing loss is so subtle because it occurs outside the range of speech. It may be a low-frequency hearing loss or a high-frequency hearing loss, where your ability to discriminate speech in normal conversation is not affected significantly. Sometimes in those cases, a feeling of fullness or pressure or the ringing in the ears is your best sign that you may need to get your ears checked. Culturally, we need to recognize hearing loss as part of aging, but it is something that we can potentially control and manage. Maybe not perfectly, but better than we thought in the past. I always applaud patients for coming in and having that discussion with us, says Dr. Hunter. I recognize some solutions aren't perfect, but many patients and families report great benefits from hearing aids. Most happiest, we need to have healthy ears. So do care of those precious ears. Next time I'm going to talk, when we dive into where this topic is in Scripture, it's all throughout Scripture, I'm going to talk about how you can increase your attention span with a few simple techniques. Okay, that's all for now. This show, we're going to go out with a little more music, and then we will see you in the next one. Like I say, we're going to dive into Scripture and attention span. See you next time. Remember to like and share and subscribe, and take care of those ears. Bye now.